snowdrops and anemones. So that makes me very happy, even without the sunshine. So just a little bit of housekeeping that you hopefully all know. So if I do this bit, then anybody who's still joining, it doesn't matter too much if they miss this. So please do join. Please do keep muted unless you're a speaker, because we know things happen in the background. People bring you cups of tea. The cat upsets the cup of tea. All of those things mean that sometimes having your mic on, if you're not actually speaking, can mean that we get background noise, and especially if somebody is saying something important and not just chuntering away like me, then that can be super distracting. So we are and what else have I got to tell you? So yes, just for any of those who have signed on to the LSET workshop, very unfortunately the presenters are unwell and aren't able to deliver it today, which is, I know, really disappointing, because I'm sure that's one of the ones that would have been you know, a really significant amount of interest in. So so you will have had an email from Joe giving you instructions as to how to join an alternative workshop. So any problems, then do get in touch with Joe, and he will, I know, because he does it all the time for us, he will be able to sort you out. So just a reminder, this is our national event that we deliver through our RISE contract with DFE, and is usually an opportunity for them to keep you updated on things that are happening, and policy and practice developments. And I guess at the moment, just before I go into sort of saying a bit about the rest of what we do on the programme, we're able to do slightly less of this at the moment because, as you know, government is thinking about the future of SEND policy and what it thinks is the best possible shape for things in the future. I think we've had quite enough reports that have helped us to understand that the current shape of things is not really working. So obviously government are thinking hard about that, and that is what Christine will be starting to explore with us this morning, and hopefully by the time we meet again we'll be in a stage where actually we can be sharing some really concrete plans from government about how to take things forward. So other than doing wonderful things like the national event and various webinars through the RISE programme, we also offer support to local area SEND partnerships around a variety of issues that they might be facing. So do get in touch with via the emails on the screen if you think that you might be looking for some support. It's completely bespoke, so if you've got an issue that is not on the screen that you think you might want support with, then don't let the fact that it's not on the list stop you getting in touch, because you know all of these things at one time we didn't do, and then we saw that there was a need for them, and now we do them. So you know, if you need the help, then we will explore what that looks like with you and design and develop it with you. As will our partners, the National Development Team for Inclusion. But there's just a list of some of the ones that our bestsellers, probably the best way of describing them. And we do have a brochure online that says a little bit more about those and what they look like. Okay, so you have got 2 workshops. I know not everybody always is able to stay for the workshops, but if you want to and you don't have a workshop, then do please email you, and Joe will be able to assign you. And we have got a really great list of workshops, and I was able to, the one on the Healthy Parent Carer Programme, I was lucky enough to meet Belle on Tuesday at the National Network of Parent Carer Forum conference where they had a stand. We were involved in the development of the Healthy Parent Carer program, and it is really, really great. So anybody who is not sure about what workshop to go to, that's definitely a good one to choose. I do think that quite often when you look at a local offer in an area, there's lots of stuff for parents around how to be a parent, but less around how to stay healthy and resilient as a parent. So, things for parents in and of themselves. We've also got something on AP from Olive Academies, which will be really great, and an offer around assistive technology, learning from research with children, young people and caregivers, making sense of sensory processing. We haven't got the early language. And then we've got developing as opposed to delivering services for children, families of children with SEND. So really looking at that, at how you do co-production, empowering families. So really, really important there. One of the things that I was able to share with the National Network of Parent Carer Forums on Tuesday was we were going through all of the research reports that have come out of the What Works in SEND programme that we deliver through this contract, and a really, really strong theme for those areas who are doing well is that they have got co-production right and they are taking it seriously, and it is an absolutely foundational bedrock of good services and when services are getting it right. We've got a workshop from Kath Bromfield on communication strategies with parents and carers. And then we've got Adam, so he's speaking, but also we've got a workshop from Adam on the local learnings from area SEND inspections and the upcoming review. So a bit more of a chance to sort of have an interactive discussion on that. So, Macy Ray, anything else that I need to share with people? Oh,
yeah, just the webinar that we wanted to mention that's coming up in March, which is on the same theme of co-production. So there's a QR code on the screen and I've just popped a link in the chat as well if people would prefer to sign up that way.
Brilliant. So yeah, do, as I say, really, really important to get co-production right. And yeah, those local areas that we see flying are those that have really strong co-productive relationships with their forum and with other groups of parents in the local area. Okay, so we are going to hear this morning from Dame Christine Lenahan, who is going to be, as I say, telling us what she can about government thinking and asking us for our thoughts, I think, on what the direction of travel should be. And then we've got learnings from area SEND inspections and the upcoming review. So obviously, local area SEND inspections absolutely critical in terms of us understanding how local areas are doing in terms of SEND, and also for local areas to kind of get that health check, if you like, on the system and understand those things that that may be going really well and some of the things that they need help with improvement on. And that is where we come back in, because quite often after local areas have had an inspection, if it hasn't gone as well, that's when DFE ask if our help and that of NDTI can be called upon. So that should be really interesting and give us a sense of of their thinking, and maybe Adam will be able to say a little bit about how they see the interplay between the school inspection framework and the area SEND inspection framework, although he also may say that they don't know yet until they know what the policy will be. But anyway, I'm sure he will also say what he can. So on that note, I think we're going to hand over to Christine Lenahan. Do we have, there you go. I knew we had a poll beforehand. So we have got a poll for you to, and we realised that, you know, that this is a dangerous thing to do at the moment. But in one word, describe the impact of the current state of the SEND system on you. So how does it make you feel? So we know that whoever you are, because we work with you, that you are, you know, that you are incredibly committed to what you do. And I haven't met anyone who works in SEND who doesn't do it because it's their passion. That seems to be the sort of a job that attracts those who are absolutely committed and passionate about what they do. And therefore, if you're working in a system which isn't necessarily working as well as it can, then obviously that doesn't always, you know, that can feel difficult. And that won't be the case for everybody. Hopefully, we've got some people here where things are going brilliantly in their local areas, and you'll be able to say great. But anyway, if you can let us know in one word how you're feeling, what is the impact of the SEND system on you? Okay, so not too bad. I would say pretty resilient, um, but only just. Is that a fair analysis, Macy?
I think so, yeah.
So yeah, and luckily not too many people in the not so good and not great at all, but obviously any people in that area is not good, and we've got to hope that some of the reforms that have happened already, we have, you know, got a new school inspection framework out. We have got the curriculum and assessment review underway. Hopefully some of the things that are already in train will start to make a difference, and move some of those figures around, so that, you know, it would be really great. You all do such an amazing job. It would be great if it felt as though you got the benefit of that, and we're doing good and great.
I think, Amanda, there's some people feeling overwhelmed in the chat and frustrated, but a few hopefuls and flexibles, so a bit of a mix.
Brilliant. Under-resourced, yeah, that's and challenging, frustrating, yeah. Oh, and Jackie can't still see the slides. Hopefully Jackie has come back in. And yeah, Christine said that she likes hopeful, and that was kind of one of the messages I was trying to share at NMPCF on Tuesday, that it is incredibly important that we remain hopeful and that we remember that actually the system can work. We know it's not set to SEND, that it's difficult to make it work, but actually there is some really great practice going on. We know some people are doing some amazing things, and that's why we always try and share those, especially in the workshops, so that people can get a sense that that things can work, and we don't just have to wait for policy change, but we can do what we can with the current system, in order to make it work. So have we got another poll, Macy, or are we moving on to Christine?
Yeah, I think we're moving on. There's just a few Teams issues with the poll, so we'll move to Christine if that's all right.
Okay, all right. So if people can, I can see it, underpaid. Right. Okay. Well, I don't know that Christine needs any introduction, but just in case people have been under a rock for the last 20 to 30 years, Dame Christine Lenahan, previous director of the Council for Disabled Children and now strategic advisor for the Department for Education, who is going to share with us current developments in SEND thinking and policy. Over to you, Christine.
Thank you, Amanda. I also can't see the slides. There's something wrong with my Teams this morning. So Joe and Macy are going to do the slides for me. I won't be able to see them, so they might be slightly disjointed, but you know, we carry on. It's fine. Thank you, Amanda. I am indeed the strategic advisor. I'm going to tell you a bit about what that means in a bit. I think I've even got a slide. But I suppose what I also wanted to talk about as well was my other role, which is working in partnership with CDC, being also going into areas where systemic failure has been found post-inspection. So I'm currently the independent chair for the boards in Nottinghamshire, Hertfordshire and Oldham. And that's a real pleasure for me, because actually what you do is you go into a system that's often feeling battered, bruised, exhausted, some of the words coming up on the chat. And then you have to sit as partners coming together and say, despite the current system, and we'll look at the current system in a minute, what is it we can do to improve things? And in all of those areas, we have been able to make significant improvement. And the reason we've been able to make significant improvement, I think, is fairly clear. And it's the conversation I often have with Adam, who you'll see later, which is about a focused look at SEND. Sometimes, you know, some of you said it's overwhelming, and sometimes there is a narrative, isn't there, both locally and nationally, that the system is broken. You know, it's finished, it's gone, it's whatever. And sometimes what's happening is that it's paralysing people from doing anything about it. They're almost accepting a broken system, thinking, oh, well, we can't fix it and whatever. And yet, as Amanda said, and what so much of your evidence tells us, is the system isn't broken. Yeah, it's battered and creaking at the edges, but there is some really good stuff going on. And when we start to look at good stuff, we also start to think about partnerships. So the heart of what makes success happens, as everybody else knows, is about a focus on SEND, about a leadership system that's committed, and about a series of partnerships that work. And part of my role over the last 18 months has been about negotiating partnerships. What is it we can do in a health system that can be quite hard work to manage? Where is it we can see the spaces for sharing good practice, the spaces sometimes for finding resource? How do we really listen to parents about what they want? And the reason I'm telling you this is partly because that is what I want to take into my role nationally. I want to be able to take some of that learning and that understanding in order to look at where we're going. So Amanda's half done my job for me, but a quick resume of why we are where we are. So first slide, Joe, after the title. I think that says send data.
It does, Christine.
Oh, thank you, Macy Ray. This is courtesy of the wonderful Andre Imick, who many of you will know. So Andre is one of those people who's always been really good at evidence and statistics, and I am not. And so he helps me out on things, as he also still does some work in improvement and support. So that is your sort of one slide update on the world of SEND data. I'm not going to go into it, just so you can see it. Next one. So the next one you can see is the ISOS report that came out in July. So ISOS was doing some work, which is a consultancy, was doing some work with the Local Government Association and the County Council Network. If you haven't read this report, it's a pretty good report. It's also 140 pages long. I would say that the analysis stuff is pretty good. I'm not sure about the recommendations. And so what ISOS have done since they came out with this report, but says in there, as you can see, reform is both essential and unavoidable, is they've been going around the country. So many of you may well have been involved in ISOS workshops around the country, where they've been talking to professionals and parents in all regions, coming together with a national workshop a few weeks ago that Amanda and I, amongst others, attended, to look at, okay, what does the evidence tell us and where are we? And some of the evidence coming with that is coming into the system. And I'm going to tell you a bit about that. So if you look at one of the things they suggest on the next one, you can see issues about clarity, responsibility, accountability. We have a system that has lost track of itself and that needs to be resetting. So trying to understand how we define what SEN is anymore, how we define how EHCPs work, and how we work across the system on accountability and responsibility between health, the local authority, schools, etc. So one of the challenges that I've had on the boards locally that I'm sure many of you share is we have challenges about getting the system to work properly, but we're doing it when demand is rising all the time. So more and more parents are thinking, hold on, this is what my child needs. More schools are saying this is the best way of getting support, so maybe this is what we should do. And so you work on trying to get things efficiently, effectively through the system, but you feel like you're sort of climbing a hill backwards. So what is it within that we can do that actually delivers the best outcomes to children and young people, but doesn't mean that the system spends its life feeling overwhelmed, as many of you looked at? One of their recommendations was a national framework. This concept of a national something gets called all sorts, was called national standards under the last government, gets called a national framework or a national framework for inclusion under this government. It's very much about being able to reset the offer. What is the offer of the state to families of children who have additional needs, and what are the professional roles within that we can hold people to account for? So what should we all expect? It goes back to some of the things that Amanda was talking to NNPCF about on Tuesday, which is about, and that I see in my practice, which is that I can go into the most amazingly inclusive services. They're really good. They're parent friendly, they're supportive and whatever. I can go in a service that looks the same but isn't the same. So what is it that underpins that? So some of that, isn't it, is about resource, funding, workforce that's effective, etc. Some of that is also about culture and leadership. What is it we can do? How can we do it? If you go on to the next report, don't worry, we're only doing this quickly. These are just for your reference and your slides. You can see the National Audit Office report. And again, this idea about a system that's just running too hot. One of the things I think it's really, really important that we do, and this was part of my contribution to NNPCF on Tuesday, is we need to separate out the sort of two pillars of challenge in the system. It's really important. So you'll see the Audit Office, not surprisingly, given the clue, is interested about money in the system. And clearly, financially, the system is becoming unsustainable. That's at both school levels, but right at local authority, local area levels in what's called the statutory override. So you read in the headlines about local areas, local authorities heading for bankruptcy. So there is a massive funding challenge that needs to be untangled. It's not necessarily, I know this sounds odd, that the system needs more money. It's that we just don't know how money is being spent in the system, and we don't know what an effectively financial system looks like. So people need to think about that, and I am really glad to tell you that's not my job. Amanda and my colleagues from CDC will tell you I did well enough trying to manage the budgets at CDC, and often needed lots of help. So I am not a national funding guru, but luckily there are people who are working on that and trying to understand that. The second pillar, and it is separate, is that also the system isn't delivering outcomes for children in the way that you would want it to. And it's really important we separate those things out, because I have been quite worried about some of the narratives coming out of these reports that almost blame families for the fact that the system's in financial trouble. The two things are separate. And the reason for reform is about delivering better outcomes for children. And then, of course, there has to be financial reform. But when we're thinking about reform, that's what we need to think about. The next one, the Public Accounts Committee, more money. So the SEN system is inconsistent, inequitable, and not delivering in line with expectations, and crucially, inevitably undermines parental confidence in it. And I think the concept of parental, and I would also say professional confidence in it is crucial to how we go forward on reform. The system's lost trust in itself. It's lost belief in itself. It's lost the confidence that things can be better. And so that's one of the things why we need to look at where we're going. So, you know, what I've seen in the last 2 years or so, you know, is a system that's increasingly angry, a system that's increasingly litigious, etc. So what is it? Nobody wants to fight those battles. What is it we do? What is it we look at, etc. You can also see on the Public Accounts Committee line the last sentence, which I think, again, not the one about saying being unaffordable, sentence before, which is actually about accessing health expertise. And again, it's those blocks of change, isn't it? We have a SEN system under pressure. We also have a health system under pressure. And so much of the work that you all do is holding those things together, isn't it? Looking at how we do that, looking at that. We know Adam will talk to you later about one of the things coming out of inspection being waiting lists in health. What can we do? What can we come together? What is it about it? And as somebody says in the chat, a social care system under pressure. Absolutely rightly. So when the systems are under pressure, we know what happens because we've been here before. They all retreat. They all retreat behind the barricade. No, it's not ours. It's not ours. You know, I've been working with one of the CDC colleagues at the moment on a piece of work we're doing in an area where health and education have both stood behind a barricade and said, please don't make us do it. And that affects outcomes for children. So what is it within this we can untangle and sort out? Okay. Right. Come back, slides. Sorry, the slides are on my phone. Okay. Right, so that's all the stuff. Right, we don't need any more reports. We don't need any more evidence and whatever. Though, of course, we do, of course, have a select committee. The Education Select Committee, which is currently, I think, just finished taking evidence. I think yesterday was its last evidence slot for evidence. It's going to be really interesting. When it first came out, we were thinking, oh, please, no more, to be honest. But what this one's looking at is solutions in SEND. So what it's asked people to do is to say, oh, today, still time, says Daisy. Thank you, Daisy. What this committee is asking is not what are the problems, please don't keep telling us about the problems, but what are the solutions? What's the picture we can start to pull together that actually starts to help us understand that? And I've read some of the submissions as they've come in, and there's a lot of good stuff. So it's within that what is, and it's about trying to do two things at the same time. I think we are. Oh, thank you. Is one, it's about how do we improve the system we've got? Can we improve it in a way that delivers the change that we want to see? Or do we have to think more radically than that? Do we have to think beyond the system? Do we have to believe that the system is the system? That's really important because in 2009, 10, whenever it was, when the first green paper came out before the Children and Families Act, that's what we tried to do then. Now, you might think we didn't do a very good job given where we are now, but there was some attempt there to think, what is it we can do that resets the system, that gives children something differently, that stops where we are now? So we're trying to look at solving a system currently, but also thinking about how can you reimagine a system that promotes the outcomes we want to see. A couple of other things going on the slides, thematic reviews. Adam will talk to you more, so I'm not going to talk to him a lot, but just this issue again about children coming out of the school system. What is it we're doing? What does it look like? We know that these children will disproportionately be children with additional needs. And so what we're going to do and how we're looking at that. And then a couple of slides on Children Wellbeing in Schools Bill. Probably see more of this in terms of schools. And this trying to understand this issue about where children are in the system. Some of this is coming from the sort of Sarah Sharif case, yeah? A child taken out of school and then murdered by her families with nobody keeping an eye on her. But some of it is also coming about from some evidence we've gathered over the years about some, and a very few schools, actually suggesting parents take their child away to home educate rather than adding to their exclusion stats. So trying to understand what is, and that is not to say that there are not some really good home education programs, it's trying to get to the bottom of that. Yeah, and the issues on local authorities directing academies. One of the things that government is really clear on, and I'm going to show you what this government is committed to in a second, rather than hark back to the past, is the idea of localism, so that children are educated in local schools in local areas. And that can be difficult when all of those schools are academy schools. Now, where it works well and people work together, we don't have a problem. But we don't legislate for the world being a good place that everyone likes each other. We legislate for problems. So try and understand that. And then there's just a slide on effective elective home education, because it's one of the issues that is coming through as a concern. And I think probably causing anxiety around the system. I've heard some sort of fairly outrageous things that social workers are going to do in terms of children who aren't in school. And as an ex-social worker, I can tell you that they're not true. Okay, right. Let us go on to where we are. That's the background. We've got the evidence. Where are we? So this government, as you know, came into our office in July. Oh, we have a ministerial commitment, Macy Ray. Yep. Yours nodding at me. Good.
Yeah, that's on screen.
Thank you very much. So this is the list of the government stuff. I'm not going to read it. This is yours for evidence. What I will say is that I was appointed by Bridget Phillipson in October, beginning of October. And we've worked with her quite a lot now. And so these are our sort of civil service commitments. These are the sort of announcements. But she is absolutely passionate about this area. She is really, really keen to work on SEND, and she understands the issues behind it, etc. So she's already working across the system. There is already cross-governmental work coming into this, as DFE realise that this is not a situation that they can solve in themselves. So you have to work with the Department for Health and Social Care, but also the Ministry of Justice, also the Ministry of Housing, Communities and Local Government, and with the Treasury and with the number 10 offices. So this is a Secretary of State that's absolutely committed to reform in this area. I had the pleasure of listening to her on Monday, with the whole of the ministerial team present. So you'll know also that one of the things that happened when this government came in was that the ministerial responsibility for the world of SEND moved in the Department for Education from the Vulnerable Children's Minister, Janet Danby, to Kath McKinnell, who's the Minister for School Standards. And that, although that sounds like shuffling cards at a deck, that's actually been really important about making sure that all policy looks at children with SEND. So this is a ministry, this is a government that is committed to reform and is quite frightened of it. And the reason for that is whatever reform happens in this area, when the button for reform is pressed, and I'll tell you a bit more about that, then actually it's going to be excitable. Yeah, because everyone's going to have a view about whether it's the right reform in the right place. Is it about supporting the system effectively? What do schools think about the children that they're being asked to take? Are families worried about rights and legal rights and entitlements under the system? What are we asking of partners in terms of health, etc.? Can they give it? So you know that it's going to be complicated. So what's she done so far? The second slide says that she's appointed me. Why would you not? Now, part of my role is to provide challenge, and I'm really clear about that. Those of you who have worked with me in the past know that I'm fairly straight talking, know that I'll say what I think, and know that I want to use the evidence that's out there. So some of this is about being able to take on issues, and that's partly because the civil service is a funny place. There are some really, really good civil servants. They're excellent, and some of them may well be on this call. But actually, they work in a certain way. And part of the role of CDC over the years, part of the role that Amanda, Anna, and the senior team still play is taking that evidence in. It might look like this in Whitehall, but actually this is what it feels like in Bury or Hull or Grimsby or Retford or wherever it happened to be, yeah? So some of that is about that challenge to say, what you're going to do. Because also, if you're going to start to change the system, the last thing that we want to do is change the system in a way that actually delivers worse results than best results. So some of it is about challenge and advice and whatever. And some of it is about working with you. It's about bringing people together and getting their feel of what the issues are and the challenges are, but importantly that where they see solution. So one of the things we did at the NMPCF conference on Tuesday was we said to parents, reform is coming. You've seen the evidence, you've seen the reports, reform is coming. And therefore, what are your hopes and fears? What do you think is going to work for you? How does it look like and whatever? And that's the dialogue I want to have with all of you as this develops. Partly, what's the starting point for this is the minister has appointed two new groups. The first one, I think, coming up now on your screen is the Neurodivergence Task and Finish Group. So all of you have seen the evidence on the changing needs of children in the system and what's happening and wherever. And we know that children with neurodiversity, neurodiversions are a big part of our change population. How do we meet the needs of children running through from dyslexia, through to ADHD, through to the autism spectrum, and through to children who've got some of the more mental health needs? How do we meet their needs, and what's evidence telling us? What's the facts about why this population seems to have changed? What are the facts about what works for this population of children? What that is different than what works for other children? What's the same? So I've been delighted to work with Professor Karen Goldberg from the University of Birmingham. I've spent 3 days with Karen this week, on and off. And so she is now leading this particular group. These are short-term groups. They just do that. So they started in October, November, and they finish in June. And they meet monthly. And you can see the sort of mix of people on the group. And the idea is to collate the evidence behind this area and to come up with solutions. So Karen is also in a team going out to see effective practice, talk to people about works, look at what the evidence tells us. Some of you might know some of the group. I have a particular liking for Mark Mon-Williams because he did the amazing Born in Bradford survey when you were looking at massive population change and some really, really good early intervention work there for children identified early. And Karen's group has a remit that goes through from early years through to school stages and beyond. So Karen is starting that piece of work, taking evidence. You'll start to see this become more public as we develop that. Thank you, Leslie. Well spotted. Right. Okay. You always know when you've touched a nerve, don't you, on Teams? Let me explain. One of the roles Karen has is working with the NHS ADHD Task Force Group. So there is a Venn diagram, if we had that sort of capacity, if I was doing you terrible drawings, which I miss. It's one of the reasons I miss doing physical presentations. I used to love doing terrible drawings. Anyway, if I was doing a terrible drawing, you would see that there is a series of Venn diagrams for these groups, not necessarily just a block. The first Venn diagram would take you to the crossover with health. So crossover with health is the ADHD task force, etc. And also Mark Mon-Williams, who is the scientific advisor in health on these. So there are a number of health factors built in, but Karen has been given deliberately a fairly limited terms of reference because we have to have a task completed. So health is there. The other thing that you are right to pick up in the chat and became quite a big conversation on Tuesday is it doesn't look like there's family representation. There is, because we can't assume that these people do not have lived experience, etc. However, we have looked at how to work. And Becky, we had a long conversation about an NPCF on Tuesday, and we are looking at how we make sure that throughout the groups that you will see, parental voice, parental expertise is built into this. Yeah, so these are starting point programs that will develop, and where it's fair to say active learning is happening on a day-to-day basis. The second group that you'll now see coming up is good. That's what we like to see, Anne. The second group coming up is the Expert Advisory Group on Inclusion. So what this is, and one of the other questions we asked people the other day is, the government is keen on looking at what is inclusive mainstream. How can the majority of children be educated locally in a school that works for them? Yeah. So Tom Rees, who chairs that group, is the chief executive of the Ormiston Trust, which is 44 schools. He is also the parent of a young man with complex needs. We've tried on this group, it's a smaller group, and it is about understanding effective practice in this area. And if you go on to the next slide, you'll see some of the things that the group's looking at in terms of areas of work, etc. Okay, so inclusive classroom practice and culture, partnership with families. So the whole work stream on partnership with families. No, it doesn't look like it from the slides. I promise you it's there. Identification of children. So how do we make sure when children go into mainstream schools, they are supported early, their needs are met earlier, etc. What sort of workforce do we need, and how does it look like? And then this whole stuff. There's enabling conditions and incentives there. The idea is that's team around the school. Who do you need to support a system to work? And one of the other things that we're trying to work through, which came out, if you think about Amanda talking about some of the AP stuff, is if you took a whole range of children across a whole community, what is the best place for children who need inclusive mainstream education that's going to work really well for them, who need alternative provision, who need a special school, who need whatever? What does that look like? How do you make sure that children are in the right area, in the right place, with their needs met? That's the sort of role of that group. And again, you will start to see this becoming far more public with the engagement that people are talking about. Lorraine Mulroney, if you can solve health needs in school, you will be a wonderful, wonderful woman. I've always said you were a wonderful woman, but it is an issue. But you're absolutely right. It's that team around the school. What is it? What does it look like? What is the workforce of the future? What is its capacity? What are its skill sets, etc.? So they're fairly big tasks. Right, the next slide just shows you pictures of us all. I'm sure that's lovely, because part of my role is to work across the groups. Yeah, it's part of working across the groups, and it's picking up stuff like this. Why isn't so and so? How are we talking about whatever? So at the moment, okay, go on. There's a SEND inquiry. There's a select committee inquiry. I'm not going to talk there because we've done that. Right. So wider issues. Now I'll touch a bit more about this. So one of the things that we've been starting to look at is those particular groups are looking at specific aspects of the system. Yeah. One of the things we're also looking at is that whole look across the system. Yeah. That whole look across the system that says, how does every part of it make a difference? We're looking, as I said to you before, about money in the systems and the separateness of that, etc. And then let's have a look at the next one. One of the focus you can see in this is all of it appears to be focused on schools. However, we are working across from early years to post-16. Karen's group is specifically looking at early years, and I spent yesterday morning with the DFE's early expert advisory group on early years and SEND, where many of the sector are involved, where parents are involved, with the whole system, there's a whole group of people. And we've asked that task group to look at how do we pull together the best out of early years. What are the barriers? What's the vision for inclusion in the early years? What's the workforce look like in early years? So that group has a sort of series of tasks in order to bring early years to the stage. And one of the people who crosses both early years and schools is Anna Marie Hassel from Nason. So there's a sort of process in place. And then the other side, of course, is what happens post-16. So looking at post-16, beginning to understand that. Cross-government, etc. Yes, even I've written, and this I can't see my own slides now, is we know there is a key issue at the moment in relation to health and schools. Absolutely, and I can see the chat. Do you know what? We used to have the most lovely unison leaflet, didn't we, Amanda? Anna Gardner will remember it, which talked about cooperation and support for these children in schools. So who knows what's happening. However, there we go. But we are back to looking at that particular issue. We're back to looking at across. And Carol, you're absolutely right. This isn't just about health needs. It is about speech and language, OT, etc. So it's that system around children. What is the system around children? What does it look like? How does it build? And whatever. We want to learn from the work, as I started off saying, of improvement boards. We want to learn from the what works in SEND stuff that Amanda was talking about earlier. We want to understand what is working, because the last thing we want to be able to do is make reform happen that actually then isn't deliverable. The other thing that we are not doing is underestimating the workforce. Okay. We are developing, they are not developed, a series of working principles. Which you should be able to start to see. Just the headlines. These came from the Inclusion Expert Advice Group, but we want to look at how we develop them across the piece. Being clear about what we think inclusion is. Talking about inclusion by design. That's core. That's about SEND is not an add-on, not an extra, not an on-the-edge stuff. It is integral to how we deliver. Talking about ambition. One of the things that you see in all the stats and the evidence is many of the children that we work with suffer from a poverty of aspiration. Yeah, we don't think they can do the best. When we work with so many young people who want to be part of a workforce, who want to have something to contribute, who want to deliver, we want to recognise the current strengths in the system so we are not undermining them. Next one, and where we are now, is developing that full consultative comms and engagement approach. So I've started to ask people around the system, how do we consult and engage? How do we hear your views? How do you understand what's going on for you, etc.? So, Anne, in your chat, one of the things we talked about with the expert advisory group yesterday for early years is how do we make sure that children with SEND can claim their legal entitlements. We know that actually not enough children are. So what is it there? If you think that's our starting point. We want to be evidence and data informed. You'd be glad to know, because we have to make decisions on the basis of evidence. And the other thing we want to be able to do is respect diverse opinions. People don't like change. And when change comes, people will think it's good, it's not good, it's whatever, etc. So we want to be able to do that. And we want to be able to be confident at the end of a process to come out and say, we heard. And the reason we went to decide these things was because this is what we heard. And actually, we had to untangle these things because what we are trying to decide is what is in the best interests of children and young people. Okay, there is a final slide before I stop. That final slide just says to you that change is coming. It has to come. It has to come, and it has to come quite soon. Because if you think just about the politics of life, this is about being able to bring in change at a point of the electoral cycle where we can deliver it. Yeah? 5 years always seems quite a long time when governments are elected. It zooms past in the sort of blink of an eye. So change is coming. We need to build on good practice in the system. Government is committed to co-production. So one of the key things at the moment is developing comms and engagement strategies. It's keep coming back and talking to you. Sometimes in big groups like this, where I know it's not easy to have an interactive conversation, though you do your very best on Teams, but sometimes it will be in smaller groups around the piece. It will be about the different constituencies that you represent, the different regions that you develop, and that is what is being developed currently. So over the next couple of months, not even that, you will start to see change and more evidence of it. I will be able to come back to you and say, that was all lovely, wasn't it? But this is what we mean. I can't do that yet, but I want you to know it's coming, and that's where we are, and that's why we're currently in listening mode, and therefore I will stop. Amanda.
Thank you very much, Christine. I'm sure there will be some questions for you. And I had a couple of thoughts as you were speaking. We had a great presentation yesterday at the Health Policy Influencing Group. Sorry, no, not at the Health Policy Influencing Group, at the NHS England Stakeholder Council. There is a crossover between membership, which is why I was confused there. Anyway, we had a great presentation from NHS England and from Mando Watson. Lots of you will know Mando Watson and will have seen her presentation on connecting care for children. And 10 years on, NHS England have really picked that baton up. You know, machines never move as quickly as we want them to, but anyway, they have now picked it up and are now instructing ICBs that everyone should be operating neighbourhood multidisciplinary teams for children and young people. So one of the things that I raised with them yesterday was, okay, so what's the read across between that and schools? So obviously those models are sort of via GP and family hubs to individual children, young people, but getting the read across to schools and early year settings will be really, really important if we're going to get this right. And I think they're very alive to that challenge. So yeah, and Lorraine, did you, I mean, we have got some, I believe, guidance coming from DfE around managing meds in schools. I think it's been coming for a while. So perhaps we'll have a little prod again and see whether we can speed it up. But yes, we at CDC have been working on a briefing as well, and it was kind of one of those things where, do you publish it before the guidance comes out or after? So if it looks as though the guidance won't be out anytime soon, then we'll publish ours sooner rather than later, so that people have got something as helpful as possible in that area. But one of the things that we've also been really clear about is, is that community models and making sure that you have an integrated community model of health is the way to make sure that you've got that proper oversight of delegable tasks. Anyway, sorry, I think I've picked up most of the issues that I spotted there in the chat, but I am sure that there are people who would like to come in and ask Christine some questions. And Christine, have you got anything that you kind of are particularly wanting to hear from people?
Icon helps, wouldn't it? Not really. I'm really interested at the moment. I'm reading the chat, to be honest, because I think what you're seeing there is some of the stuff that we need to link into, like the change programme. So I think we've got a meeting coming up with change programme leads at some stage, trying to work out some of the stuff. Leslie, that classification of needs in 2012, I can't remember it, so it would be good to see it again. Amanda probably can, because she's got that sort of brain. But that sort of document, what is it? Do we need, we're still trying to work out what is the changed profile of children? What is the changed classification of needs that you talk about there? Are we talking, for example, in terms of schools, of redefining a new normal of children? So these are the children you should routinely expect in your classroom. They may well have been different than the children you had in your classroom 10 years ago, but what does it look like now? And somebody's talking here about neurodevelopmental assessments. And that's the piece of work that Karen's doing. So, you know, that whole issue again, which we hear again and again. And when I went round the parents' tables on Tuesday, was there again and again about the difference between diagnosis and need. How can you get needs met? When do you need a diagnosis? When is it helpful? When is it not? Does it get in the way of us meeting needs, etc.? So it's some of the things coming out in the chat, which I suppose I would expect to see, which are useful. Andre probably will have it. But yeah, anything else from people would be helpful, really.
And there was a question there about co-production and your views on it, Christine. So, and I know that that was something that came up on Tuesday as well. Is that something, do you think that that's something that DFE are going to address within their thinking on the new plans, or is that something we should be helping them with, do you think?
We should always help them, Amanda. And I think it's partly because I worry about co-production. Don't get me wrong, before you all go wild. I think co-production is essential to what we do. However, I don't think that people often understand what co-production means. So I think that while one of the voices here is to make sure that people are engaged, and people are engaged. And when you are picking stuff up as you are on this, that says, hold on, why aren't you talking to this person? Why are you doing it? And we know that co-production is not doing a nice plan. So I could have come today, possibly, with a nice plan and said, by the way, folks, it's all clear, this is what we're doing. It would be a bloody dreadful plan, because it wouldn't have taken in the account of people, etc. So that's what we're trying to look at. Yes, local production, co-production charters people are talking about, and it's actually how we do that, how we understand that, etc. One of the things I'm doing tomorrow is I'm doing the big get-together for the Multi-Schools Council, which is an East of England young people's participation event. So yeah, it's their voice, it's their understanding, it's parental stuff. And yes, please, Sarah, the unique child identifier. How long did we start campaigning on that, Anna, Amanda? 25? Anyway, so yeah, for me, but you're right. I think that co-production will be one of those things that keeps being a challenge, because I think that government will think they're doing it and people won't necessarily think they are. So there's a bit of that going on, I think.
And there's a good question there from Catherine, Christine, about which we've been thinking about actually, and talking to NAS and ADCS about in terms of specialist provision. But how do you get that? You know, at the moment we know we've got a situation where children leave mainstream and go to specialist, and it's a one-way street. They never come back again. So what's the thinking about how do you get that right? How do you make sure that children can go up and down, that there's in reach? And is that about funding models? Is that about what's it about? What's the thinking?
I'm sure funding models is a very, very key part of it. We've been trying to do this in drawings, more terrible drawings, because often we look at the provision for schools on a line, and on one end of it is mainstream schools, and the other end of it, somewhere down here, is some sort of special outreach something, instead of a sort of circle that moves round. Yeah, so we've been trying to work out how to draw that, and you're absolutely right. So taking the learning from AP stuff about in reach, outreach, part-time placements, short placements to get back in, etc. It's one of the reasons why one of the people on the inclusive education group is Susan Douglas, who actually runs a specialist MAT. So she runs a special schools MAT. So again, what we've been trying to think about is what is the move across? How could you do it? We've done it in the past, if you think about it. Some of the stuff on dual registration for children, all of that sort of stuff. But you're right. How do you do that? And how do, and I suppose in the very best of the inclusive schools that we see, you see some of that. You see a pathway. You see schools that have the best of the inclusion resourced hubs. So people doing some really good stuff on including schools within that broader setting. I went to see a school the other day with a range of children with quite complex needs as part of an inclusive school, but where those children were safe and secure and whatever, because there were specialist spaces they could go into if they felt uncomfortable. There were specialist teachers who understood what their needs were, etc. And they had a really good link with the specialist services around it. So it's that sort of stuff around it. So you're right. So, you know, people are saying, yes, it can happen. Yes, of course it can happen. So when I went to that school the other day and I sat and I had the most amazing head teacher who basically said, these children are all important. These children are part of my school. They're my children. And some of it is that cultural stuff. And even when we were doing the 2012 Act, when we were doing the Children and Families Act, we were trying to understand how to build in culture into legislation. Section 19 of the Children and Families Act was my favourite section, and that was about, but it's something we're going to have to do a lot more work on. And one of the things Amanda said earlier is obviously this week the school inspection framework was released for consultation. And within that, you see inclusion, 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 inclusion. And we're hoping that's one of the things that will support. It's that carrot and stick approach to change that we're trying to look at. So Hayley, lots of diverse schools who are academic. They're the group that will worry me most, because so many of those children seem to be coming out of school. And yet we know in good schools they can do it. So there's quite a lot of stuff where we're trying to gather the momentum. Brighton and Hove, if you've got a principles of belonging as our inclusion chart for schools, yes, please, can we have it? That sounds really, really helpful, etc. So it's that sort of stuff that we're trying to get, supporting and making it happen.
Hayley,
it will not all be perfect. It will bounce. There'll be stuff of it you'll think, what are they playing at? All of that is fine, but it's about coming back, coming in and having that conversation. Sorry, Amanda.
No, all I was going to say was Hayley was asking about whether or not we understood enough about those children who weren't in school. My understanding is that Ofsted are doing a deep dive on that at this moment in time. Have I got that right? Adam will be able to confirm that for us, no doubt.
They are doing a thematic review, looking in 6 areas at children at school and understanding that, and etc. And of course, they're doing that at the same time. Daisy's put the really helpful briefing in, and they're doing it at the same time that the Schools and Wellbeing Bill is looking at what a home education register would look like and what else. So we get the feeling of that breadth. I went to a medical PRU the other week, which I hadn't been to before. So pupil referral unit, 15, 20, 25 kids. Medical, because all of the young people in that secondary education range were children who'd had suicidal ideation, so children who had thought about ending their life. And the reason that, so I had lunch with them and I said to them, tell me about why you're here and whatever. And I suppose it was quite sobering. It was the fact that for them, school was just too frightening a place. They didn't feel secure, didn't feel like they had friends, didn't feel like they could have their needs met. And there is something, isn't there, in the midst of all of this, which is about how do we make schools safe, secure places for the broadest number of children? Because that shouldn't be where people are.
And where was the medical PRU? Is a question in the chat for you, Christine.
So it is a PRU that has both a medical site and a behavioural site. It's in Oldham, it's Kingsland School, and it's run by the wonderful Emmett Patel, who's brilliant.
Brilliant. And just on the questions in the chat, any that we sort of haven't answered through the presentation, we will follow up and see whether Christine or anyone else can provide some responses on them. And also been really great to see people offering good practice and solutions. Definitely. As well. So as you we haven't talked about it this morning, but as hopefully you know, we've got the effective practice evidence framework on the What Works in SEND website, and we've collected some brilliant case studies in there that help people who are thinking about kind of improvement and what works, to understand what's worked in other areas. So we may well be following up with some of you to see whether or not you'd be happy to do a case study, because it is so important to share. So one of the things that came out in one of the reports we did recently was people really wanting access to good practice, and we have started to get a really good range now on the What Works in SEND website, so please do check it out. And there will be coming soon the reports on integrated working and joint commissioning, so they should be really helpful. So thank you so much, Christine. I know it's a frustrating time for people because they know that change is coming and they don't know what it is. So thank you for doing what you could to shed some light on the direction of travel and where things are going, and hopefully that's given people a sense of where we're at. And it's always lovely to have you back. So we'll look forward to probably seeing you next time with a further update. So very proud of myself because it is bang on 10:35, which, if you are looking at your agendas, is when we are supposed to be moving on to Adam. So I'm going to introduce Adam Sproston. Adam and I seem to have been spending a lot of time together, which is great. And he is going to be talking about learnings from area SEND inspections and the upcoming review. So over to you, Adam.
Thanks, Amanda. I'm going to share my slides, and my colleague Jess is joining from CQC. So let's try and do this. And it always says I don't have permission, and I just click OK, and usually it works.
It has worked, Adam.
Oh, that's what we do in teaching, isn't it? We just do whatever gets the lesson over the line. So it's great to be here this morning. Colleagues, my name's Adam Sproston. I'm a senior HMI in inclusive education in Ofsted. Quite a big job on our hands at the moment, and working with yourself quite often, Amanda, but also linking in with Christine regularly on things that are happening in the sector. I'm responsible for our approach to inclusion, and that's across all of the remits, so early years, schools and FES, but also something that we'll touch on in a moment is our area SEND framework, which we do with colleagues from CQC. And Jess, have you joined the call?
Yes, yeah, I'm here.
Ah,
Hi,
brilliant.
Hi, everyone.
Just a quick introduction from you, if that's all right, Jess.
Brill. Hi, morning, everyone. So I'm Jess Taylor-Byrne, and I'm one of the operations managers for CQC within the children's team. So a national team of inspectors, and we lead with Ofsted in terms of the area SEND programme, thematic SENDs, which we'll be talking about as well, and some other joint inspections. So really good to be here.
Thanks, Jess. We've got a brief agenda here, so I'll take you through the first section and then handing over to Jess, who will tell you about our thematics work and some findings from that. And then I'll pick up on area SEND review and end just with a bit of a push for you to all submit something towards our consultation, which is for our education framework. So we'll make a start, area SEND inspections. It's gone a bit similar to Christine's now. It's gone a bit large on my screen. There we go. If I turn that off, and I'll just go for it. So hopefully that slide's on the screen now. We refreshed the area SEND framework in 2023. And as Jess has clearly explained there, we do them in partnership with colleagues at the Care Quality Commission. And the aim is to evaluate how local area partnerships work together to improve the experiences and outcomes of children and young people who have SEND. Really important now that we talk about the word partnership, because it was lovely to hear in earlier comments from presenters today. That is what makes the biggest difference in areas, how well everyone comes together to support those children. And partners will be those health leaders who will form part of the ICB, the local authority, the schools in the partnership, including those in MATs or that are maintained, early years providers and colleges and further ed as well. We also find a lot of the charitable sector, the third sector, stepping in or being commissioned to support large numbers of children with SEND and doing a really strong job in the area. So that it's how all of those services come together. And we hold local areas to account and champion the rights of children and young people with SEND and their families. We inspect all 153 local areas, and the footprint for those areas is the local authority footprint, just to make that clear. Local areas receive a full inspection, and that's every 3 to 5 years, and that depends on the previous inspection outcome. And we will be carrying out monitoring inspections of areas that are found to have widespread and/or systemic failings. We also conduct visits to 6 local areas each year with a theme, and we call those thematic visits. And the first round were to do with alternative provision, and we were really pleased that yesterday the department released new guidance on AP that CQC and Ofsted influenced quite heavily with our findings from that report. And I'm not going to say more on thematics and leave Jess to discuss that with you in a moment. So linking to what was said earlier, we don't really need more evidence about the SEND system, but actually this is where we're at. So we're about a third of the way through the inspection cycle. So we've done 50-ish full inspections at the moment. You'll see the published outcomes here. There are some that are still moving through quality assurance processes, etc. But you'll see there that 14 of the areas had typically positive experiences and outcomes. 25 were found to have inconsistent experiences and outcomes, and so that's about half, 48%. And those areas will have their inspection within 3 years and a positive area within 5. And you'll see there that 13 areas, so about a quarter, we found to have systemic and/or widespread failings, and they will receive a monitoring inspection. And then we'll have a re-inspection following that. What's really important, and I always say that at this point, every area has positives. Every area has positives. And if we flip that on its head, all of those areas that we say are typically positive also have areas that they can work on, because this is a massive system that we're inspecting, getting under the skin of, different in every area, rightly or wrongly, and we'll touch on some of that in a moment. But actually, every area has strengths, every area has things that they need to improve. I'm going to talk you through some key findings now, colleagues, if that's all right. So we've inspection findings, we've found examples of strong practice, and there's some on the screen now. So we found strong oversight and joint commissioning arrangements in some areas. So the systems that a partnership uses to make sure that they have an accurate picture of SEND, and have tangible co-produced plans to address the needs that they've identified there, and being responsive in commissioning services. Also, I've put their governance structures, so they've got really clear governance structures in the stronger areas around what they're commissioning, why, the rationale for that, but also the flexibility that's needed at times. Multi-agency working, so approaches that support an improvement in, for example, school attendance, transition points, and the creation of education, health and care plans that set out clear actions, timescales and responsibilities. So everyone in the partnership knows how, where appropriate, they're contributing to sorting out these matters, such as improving attendance, the quality of a child's EHC plan, for example. Identification and supportive practice. So effective identification and support in early years. We've seen that improving over time. For example, the use of universal health checks that then inform the early identification of needs. Creative strategies to support children, young people and their families while they wait for assessments. We talked earlier about long waiting times for some health services. That is very patchy. So some areas will have the wait times will appear okay, but the quality of what they get may not be, and the other way round as well. So we're trying to find out what support's in place to mitigate those, and also what plans are in place to improve those wait times for children and young people. And that Professionals receive support and training to write high quality EHC plans and refer onwards to appropriate services. We also found some examples of weaker practice, and actually some areas really do not respond quick enough to rising numbers and increasing complexity of cases that they're dealing with. And actually an analysis of needs, and I'm not talking about children and young people here necessarily, I'm talking about themes that are coming through. So they've not got a robust data set or eyes on the ground that can inform them in forward planning, and then they're unable to match provision, whether that be in a school or education setting or services from health and social care to mitigate those rises. Lack of co-production, we've talked about that this morning, and actually sometimes what we find is people not taken on that journey, and I often don't like saying the word journey, but there'll be an announcement made and actually quite a few stakeholders won't have heard of where this is coming from. That links to the second bullet point, families feeling that their voices haven't been heard. Or actually that there is a lot of provision, but nobody knows about it, or the wrong people are signposted to that provision. Accountability and monitoring processes. So this is a key one really, where governance frameworks, the governance professionals that are involved and those leaders don't have the right information at the right time to give support and challenge, but also how they're pulling together everyone in the partnership to work on those key factors that the area needs to address. So, for example, not involving education, health and care to work jointly on forming solutions to aid the area. We do find quite typically just poor quality assurance systems to monitor EHC plans. And we've put on the screen there timeliness, but that also links to quality of these plans as well. So at times the professionals that submit advice, I mean this is a typicality with health and social care colleagues, that their advice then gets interpreted slightly differently in the plan. The plan then becomes a legal document, and everyone that sits around that plan is then wondering, well, how did this get in there? So a disconnect really, an oversight of the timeliness of plans. Now these are common areas that we find need highlighting as areas of priority action. And this is for those areas that receive an outcome of widespread and/or systemic weaknesses. And we've summarised these here. So again, strategic governance and oversight. So not a shared vision really for children, young people and their families with SEND, but also oversight. So monitoring, have you got the right data set so you know why your rationale is valid for most children and young people and why you're doing things. Partnership working, so we've put that top of the list there under that governance and oversight. Not bringing the right teams to the table at the right time, challenges with sharing information, which chimes with one later in the list. Education, health and care plans and annual reviews. So these typically come up as areas for improvement and also areas of priority action. So quite commonly, education, health and care plans not being completed in statutory time frames. Really important to say that we always evaluate the experiences of children and young people and their families. So that doesn't necessarily mean that that will be an area for priority action, but what we do commonly find is there's no plan of action to support the improvement of those plans over time, the quality of those plans being poor. I spoke at an event the other day, some plans that start with Adam's name in them, and then they end with Jess's name, so things that are talking about that child, their voice, and the plan's quality is just unacceptable. Annual reviews as well. So quite commonly the annual reviews are completed by the school, but then there is a backlog in ensuring that they're quality assured, appropriate, and it goes to partnership working with the right people in the room, and is the plan updated in a timely way. Multi-agency support for plans, so that's talking about the same really. If a child has significant social care input, why have those professionals that might be in the house quite commonly and have another steer on that young person's journey and their needs, why have they not contributed to their education, health and care plan and their support package? Health waiting times, so some services have significant waiting times, and we always call that out either as areas for improvement or priority action. Commissioning of services, so either commissioning plans not agreed, there not being a robust rationale around why services are commissioned, or a lack of some services. And we did find that, not to give Jess's slides away, but we did find in PFA that some services simply don't exist at adult services, and that's a challenge because EHC plans are birth to 25, and it's interesting what we found about some areas that are trying to work on that. Co-production, so listening to people, sharing their views from the earliest point, but also crafting something together. And that one you could thread in most of the aspects above, couldn't we? Strategic governance, EHC plans, and commissioning of services. Information sharing, that's a real challenge. So different systems in different parts of the partnership, who has access to what documents and who's allowed to see them. So we quite often find that that's not a coordinated approach. And also times of transition, so primary to secondary, that we highlight as well in our PFA report. And that's a nice segue, and I will hand over to Jess, if that's all right, colleagues.
Great, thanks, Adam. I'll try not to spend too long on this section because I know there's some other bits to do. But just to give an overview, if we can go to, can I move the slide, Adam? If I move it, will everyone
so
move
oh
with
no,
me?
actually, you tell me which slide you'd like.
We just go on to the onto the next slide. And I'll just give an overview of our thematic visits. So these are it's slightly separate to the Area SEND programme. So these are in addition, they're not rated, there's no outcome for them, but we look at a really kind of specific topic around SEND, have that real deep dive, and the areas that we've gone to have generally found it really helpful. And then as a result, after the 6 that we do, we have a full report. So like Adam said, the one on alternative provision came out the year before last. Last year we looked at preparation for adulthood, and this year we're going to be looking, our new theme is children not in school. So very topical. And that first inspection, they're going out next week, I think, for that. So it'll be really interesting to see those findings. Talking a bit about the preparation for adulthood thematics last year. So we went to 6 different areas. The report was published in December. So if you haven't read it, do have a look. And I'll just go on to some of the main themes that we saw. I've just seen a question. Do you get case studies about the thematics? We look at case studies. We do some tracking when we're out on site. So the framework is similar to the full Area SEND in that we look at specific cases to track. There's an overall survey that goes across all 6 of the thematics in the areas we go to, and we do case sampling out on site and visits. So it's really comprehensive as well. So if we look at some of the findings, I'll try and keep it short, but do have a look at the full report. Looking at employment, there was a shortage of training providers and employers that can meet needs for those people transitioning into adulthood. And although we saw some really strong areas where children and young adults were having their kind of career paths identified and training and supported internships, it certainly wasn't consistent everywhere. And it was a lot stronger for children that were in specialist provisions, and that planning had started a lot earlier. And that were fairly similar for independent living as well. Again, for those children with the most complex needs, that was planned for well in advance in a lot of the areas that we went to. And children that had been in care experienced children, again, that was planned for a lot better in general. So it was those children more likely to be in mainstream with less complex needs that were missing out in terms of these preparations, in terms of employment and what happened as they wanted to move on into independent living. And then if we just move on, Adam, as well, to mention about inclusion. So that was really variable and probably of no surprise, rural areas. It was trickier to see that really good practice, partly due to lack of accessibility, transport links, those sorts of things. So that was really interesting to see. But we also saw some really good things out there as well, interesting clubs, army cadets, things like that, making them really inclusive and accessible. And again, that inclusion then supported in that transition in terms of employment and internships and things like that. So it was all linked up, but fairly variable in some of those places. And then the health side of things as well. Again, variable. Like Adam said at the beginning, when we go to areas, there's always some really good practice, and a lot of that is down to individual practitioners. And we certainly saw that with health, that where systems weren't designed to be all age services and there were gaps in provision, often practitioners were holding cases themselves to ensure that young people had a better transition into those adult services. Waiting times were an issue, and it was one of our recommendations that as much as we, moving away from diagnosis is really important, in adulthood, diagnosis really does still make a difference, and those diagnoses of learning disability and autism are needed as you go into adulthood. So trying to balance that up was one of the recommendations. And also a lot of the services in adulthood simply didn't exist. That children, especially those complex needs therapies, would have access to amazing support as children, and then they hit 18 and that doesn't happen. So it just reinforced the importance of that health role in EHCPs, with that advice being really specific in them. So some really, really interesting findings. Like I said, do have a look at the report. And we're conscious as well that some of these issues can't easily be resolved. They are bigger systemic issues that need looking at. If we just move on to the next slide, Adam. But there certainly is the ability to be creative and come up with limited resources with different ways of working. And we definitely saw some of that when we were out there. So I'll hand back over to Adam, I think. Thank you.
Thanks, Jess. Thank you. We're going to run through what we're going to be talking to you about in the workshops in a moment. So we're taking the opportunity to review the Area Send framework. So after 2 years, we typically do that with our frameworks, and we're committed to doing so in the Big Listen. And you can see our objectives here, and we'll run through this with colleagues in a moment if you join us for one of the 2 workshops. So the focus is to enhance the experience of our inspections for children and young people, they're front and centre, families, and then local area partnerships. Improve the clarity and impact of our reporting, and to develop the knowledge of our Area Send workforce, so our inspectors at CQC and Ofsted. We've made clear publicly what we are focusing on and what we're not. So included in the review is our approach to engagement meetings, introducing monitoring inspections, and full inspection practice, some changes to that. So some inspector training, but also thinking about the data that we ask colleagues to provide us on inspection. Not part of the review is the evaluation criteria. That will remain the same. The methodology will remain the same, as will the notification period, the number of inspectors on site typically, and when in the cycle areas can expect to get their inspection, and any major changes to the surveys, which we do get strong positive feedback from parents and carers in particular on. What's happening next? Well, we're going to continue to engage with a range of children and young people. That's why Jess and I are here today. And in the workshops today, we're going to be talking to you about these objectives in more depth, and we'd like to hear your views. In the summer term, we're going to publish as a suite. We're going to have findings from the first 2 years of the framework, the outcome of the review and make clear the changes that we will be making, and also update the handbook, and that will include our guidance for commencing monitoring visits. And the monitoring visits will start later in the summer term. I'm just going to run you through this. Now, this is Ofsted now, so it's not Ofsted and CQC. We have launched a consultation about how we inspect in our education remits. And you can see on this slide here, this applies to early years providers, schools, further education providers, and initial teacher training providers. We're proposing to conduct inspections in a way that promotes professional conversation and collaboration, starts with the premise that everyone's working within the legal expectations and professional frameworks expected of them, understands and accounts for the unique contexts in which colleagues work and have made decisions, seeks to build a rounded picture of what providers do.
Which one is it? Because we've got two. I think one is just about to go on today.
Oh. Sorry, everyone. I'll carry on, Amanda.
Yeah, I think you're
accepts the
fine.
way
I
that-
think that was just noises off,
Don't worry.
Adam.
Don't worry. There will always be some aspects of everyone, you know, in schools and other systems. You know, there's always something that you can work on, and promotes a self-improving system. And the best way, we really do want to talk to you about this, and we've got about a couple of minutes left. I'll check in with Amanda and colleagues on the time in a moment, because I'll pick a few things up in the chat. This is what we want you to have your say on. Allegedly, you can scan that and it will take you to everything that you need to find out. So you can find on there that we have added an inclusion element to all of our inspection frameworks. Earlier, a colleague asked, I don't know whether it was Amanda or someone else, about the interplay between this and Area Send. And I'll quite commonly say to people, it's really important that we consider that both ways round. So how well are education providers doing in an area? But also how well is the area doing and what impact that might have on education providers. But actually there's not really a merging of the two, because we're evaluating separate things. You can find more information out about the proposed report card that we hope will make things clearer for parents and carers and give your views. You can do that individually. If you're part of an organisation, you can also submit an organisational response as well. You can find out more on our website. Amanda, do we have until 5 past, or have I gone a minute over?
No, you've got another whole 4 minutes, Adam.
Oof. So today we're going to, in a moment, and I won't carry on clicking on these for my policy colleagues who are in the call supporting me today, don't worry. If you're joining us on a workshop today, we look forward to seeing you. The focus of that will be Area Send and our review, and want to hear your views. You can find out more about Ofsted and the education consultation by scanning that or visiting Ofsted's website. And I'm just going to pick a few things in the chat, unless Jess wants to. I did notice the question about case studies. I'm trying to get a message out there and to all of our inspectors as well. We don't accept really case studies, and I'll talk to you more about that because it sounds a bit harsh. What we do is we sample cases, and quite typically in meetings we'll say, oh, can you think of a young person that's worked particularly well for? We might apply some of the factors. So any looked after children, does that look different for them? What we're trying to avoid is providers creating case studies of, you know, huge masses of documentation, because that's not the way we work, and also it's putting burden on providers to create that. So we're trying to, we call it case sampling, really. It's what's in a word, isn't it? But actually we choose the children, and in the thematics and in Area Send we case sample particular children to speak to them and their parents and carers as well. There was a comment about, and I've lost it now, removing the parent face-to-face meeting. And actually we meet with a large number of parents and carers and speak to their parents of the sampled cases, and also when we're with providers. And inspection methodology wise, the survey is the way to, what do I mean, robustness of data. So, for example, if we're hearing from large numbers of people about a specific case, it's got to be done in a methodological, I don't even know if that's a word, way that collates, and we have a data and insights team that say what parents and carers are saying as typical areas of concern. But we will listen to you more in a moment in the workshops as well.
I was going to say, Adam,
anything
that's
else?
that's one of the questions you're looking for more input on as well, isn't it?
Exactly. And I did
There was
spot something else. Did you, Amanda? Go on, or
Yeah,
Jess?
there's a question about progress on waiting times, which you are following your recommendation, Adam. So whether or not you felt that had had an impact, I think, Janet, that was your question. I don't know whether you want to leap in and provide a bit more clarity on that. Oh no, Janet doesn't want to leap in.
I mean, what I would say is that
No,
what I would
it's
say is we
okay.
just
I can,
published. Oh, go on, Janet.
Yeah, sorry, my voice is terrible today, but I'll just try. It's because one of the things that really strikes me about what you're describing, Adam, is that when you're talking about the area SEND system, you don't really make reference to community health providers. So there's large, obviously, trusts, NHS trusts that provide the services. You kind of make reference to the ICB as the health component, but sort of as we work in Leicestershire and Rutland, and we've got a sort of 1,700 people working with children, young people with SEND and various services. And your recommendations, it's where and when would we see the impact of that? Because our waiting times, for example, speech and language therapy or community paediatrics, for example, they're not prioritised for investment. They're not prioritised by our local system. So it's how your recommendations find their way to ICBs, I suppose, is my specific question.
I think probably I'm going to save you, Adam. And if I'm not sure if Christine's still here, but if Christine could talk to you about the work of the improvement board, certainly following, if you've got a local area that has had an inspection with where they've had systemic failings, and they've therefore got an improvement board, then that is the time that we find when we're supporting local areas that the ICB comes to the table and make sure that the providers come as well. And for instance, I know in Hertfordshire, where Christine's been supporting, that they've done a massive piece of work around access to speech and language therapy, and really kind of fast tracked that, and it's been a real focus of support. So I think what we want to do, what we need to get to a system, and hopefully government will be thinking about that alignment of responsibility and accountability in terms of any policy reform that they put in place. How do you get the ICB and the providers to the table before a poor inspection? That's when we'll have reached Happy Valley as far as I'm concerned. Thank you so much, Adam, and thanks very much for trying to pick up the questions in the chat. As I said before, if there are questions that we have missed that you have asked in the chat, we will try. People are always very generous with their time and helping us to answer the questions afterwards. So we can come back to you on that. Some of you lucky people will have signed up for Adam and Jess's workshop, and we'll get to spend some more quality time with them and go through the things that they're going to be looking at in terms of reviewing the inspection framework. So just before I let you go for a break, we've got another question for you. So what are you feeling hopeful for? We have presented you, Christine has talked to you about the change that will be coming. We don't know what it is yet. So what is it that you want to see? What are you hoping we will see in for the future? And what's making you feel hopeful? Macy Ray, how are people telling us this? They are telling us this through a QR code, are we?
No, sorry, that's just in the chat, if that's okay. The QR code
Brilliant.
is for the evaluation form if anybody's leaving now.
Okay, so I've just confused you all. Put it in the chat. What's making you feel hopeful? But if you are leaving, please do the evaluation form, because it just is so helpful. You know, we always like to make sure that these events are as valuable for you as they can be. We know how valuable your time is, and we take using your time very seriously. So that's why we ask you for the feedback, so that we can make sure that that we get these events dead on. So yeah, so please do complete the feedback form. But yeah, let us know what you want. And you know, if anybody is geeky enough to watch me at the Education Select Committee, you will have seen that one of the things that we are pushing for very firmly is greater accountability from health. And we know that you know, when I say that, I you know, I hope it doesn't sound critical of the wonderful health colleagues on the call. We know that you would like that as well. You know, that often that you're pushing against a closed door to try and work in partnership. We want to make sure that that isn't the case any longer. Oh, thank you, Laurie. So anyway, it has been lovely spending the morning with you again, guys. Please do give us feedback. Let us know what you want to hear about next time, other, of course, than the future of SEND policy. And we'll make sure that we keep you updated about especially the things like, you know, what's coming out of the neurodiversity task and finish group. And we'll also talk to DFE about making sure that the concerns that people have about membership of the groups is fully taken into account in how they consult on any future change. So enjoy the workshops, those of you who are able to go to a workshop, and I will look forward to seeing you next time. And enjoy a little break before you go to your workshop. Thanks very much indeed.